and then I get sick, go to the hospital, and then they say, we have to cut you up. And they go and do the test, and they say it's endometriosis. They bring a big word, and they slap it in your face, it's endometriosis. So today, thank God somebody has gone through it. We will try and make it easy on everybody to get to understand what this condition is all about. It tells you how complicated women, our lives are. Am I a bro? Am I a bre? Anna, Emma, yeah, bre. I mean, it's difficult just being a woman, like a sana. And then it comes with so many other things. See, we are all in pink because of what? Something that has to do with women. Just say your body, no, from head to toe, no. Bibi teachema, a complex. So today, your kasaria will say, hey, say bibi so baby. So I don't know. I'll do it in English and Chi so that we all get to understand what this is all about. Yeah. So for me, I have termed the condition the silent nightmare because when you get it, it is something that will live with you for the rest of your life. It is complicated, it is painful, it affects every sector of your life, emotionally, physically, mentally, financially, every aspect, economically, that your whole life is turned like that, upside down. And you know, one key thing is, it is affecting the core part of our body, which is our reproductive system. Nehemiah kase oba wawo die no eno na saa yare no we decided say oni ni be die sie. So that is why I have termed it the silent nightmare. And when you get it, it spreads through your whole body. It's just like cancer on dog. You wouldn't know. Sometimes you wouldn't even know cry say I yell. And throughout my research, I mean, Chumi made me come out of retirement. I said I am done. Chumi said Davy. So I have to come back to endometriosis. So for the past 2 weeks, I've been trying to read more about it. I'm not a medical doctor. Just as Hannah said, I am just an engineer who is confronted with a medical condition. And so I have decided to do medicine small by myself and get to understand it. So I am not a medical doctor, but then how I'm going to do the presentation would be, we would delve a bit into the medical side of it, and then I would use my experience as well to also let you know how I have coped with it, what it did to me, how I am managing, so that we wouldn't take things for granted. The main reason why I want us to know about it is that it is something that it is easy for us to take for granted. Why not ne menses on shedanya pain da? Say ye menstruate ya tanya pain kakra. Na ya ka kire ye ho se wo wa ebeko meboa. Ene me be ka kire say o started menstruating. And see, I wish I would get the younger ones here. So wherever they are, the ones from 10, 11, 12, who are about to start their menses or they've started their menses, I wish they would sit here and then listen so that when they come to complain to their mothers, now dimrika, Now dimrika no akoshisha doctor. Near doctor neba can be our moka se kofi o koto paramano obey okay o se doctor debi mama yenshishemu. I'm not saying that is that is like the main symptom. So if you are having pain with your menstruation, it is a definite that you have endometriosis, but it is one of the key symptoms. So when we delve more into it, you would get to understand. And there was this doctor who also put it aptly or say, rust never sleeps. Yenim rust. Metal as nache. What's that nache? Enjoy a dear say. Or the saya railway etoto nache. Rust never sleeps. Neither does endometriosis. Inti esta teke. One saw a known tema, edunya. And edunya or niema bibreo. So we will get to know. That is why. That is why for me it is a silent nightmare. Me pacho si na ye hunia eda board ne so no. Eye den ya oba ya would our reproductive system. How do I? Ya would dear. Enti say ye share bonkum ni nifa ne ase ahoma bi besom no. Ahoma na eba no ye doctor wa ha ntimi ni how. Ahoma na eba no ye fallopian tubes. I say yellow kakrano, ye ovaries. Near I to say you be saying no, and no na ya would no, the uterus. Eba asia hono, ye cervix, ne ya would no, anono, and our vagina. Okay, let me sound this question. Some people don't feel comfortable when you start talking about the reproductive system. We always want to make it like some taboo. I say adibia yentimi nka ho asem. But and also na ede or how bebre eyede ebreye nti ena no mesremo. Mumiembie ni na yenkasa. Mumienyi ferry ni bibia mfiri ho because a hadwen say oba bi ware na I've been there before. It is very traumatizing. You desire to want to have a baby. It is very traumatizing, especially the things that people around you will say, how they will say it. They don't know what you are dealing with, and they are not kind. Na we nya bema ote wase na nyamisro ninimu na chese wasem na yede asay. And see, I want you to understand that it is a very difficult thing for women because obano bebre pese omo. It's the greatest desire for every woman to be able to get pregnant and have a baby. And in view of that, we should also know that there could also be challenges that makes it difficult. Inti yesuya dewe ya obehu say aya mama yenya yema ne ho abotre because it's not easy. Menwoda, but I have experienced pain. Mafa oyaw mupa oyaw. Probably more painful than people who have even given birth. And I have done more than 5 surgeries, if I can count. Inti se mijina ha radiadom. Inti mama yenya man ho mommy enso mumu ye. Inti me dese mema bebre wa ha. Mama yenya ye man ho abo mommy yenin ko omo ho because omo bre. Ye koma eni ebehu niema bebre. Enti when this is how your reproductive system is supposed to be. Now, say I don't know if I wanted to use the phone. Na me pesa me kyerɛ mo adekodie na ɛma saa yareɛ no ɛba. Onse me say endometriosis. Na Nyankopɔn bɔ ɛma no yawodeɛ no yɛwɔ biribi a ɛline ne mu a ɛno na sɛ ɔbaa bosomidru na sɛ obu ne nsa ɛno na ɛhyɛ it breaks down because sperm biara amba, so it breaks down together with the egg that has traveled from the ovaries, has released and traveled down into the uterus. And Nyankopɔn bɔ ne sɛ saa ekwan ketewa na ɛda hɔ no ɛwɔ sɛ ɛfɛ mu ba na afa o vagina mu, then it comes what we call menses, your menstruation, the blood that you see. And see, if I can point it for people, I don't know whether it's showing, but it's not. I wanted to show you the endometrium. It was show kakra. It lines your womb, and that is what naturally and what Nyankopɔn bɔ say enda. Enti yare we say no. Baby I was no. It should be inside, but it's fine. Say sa tissue no. A free womb nim ekɔ baby fufuro biya. That is what we call the endometriosis. And then the painful aspect is that a behavior to send on say your hormones, your baby estrogen, and it controls most of our actions. Inti sa endometrial tissue no, se baby a ewo bia se ewo wutrim, se wo wonsa ho, se wo wefruma. Baby will be and also under the influence of the hormone. And a brain the body is preparing to receive a sperm for you to get pregnant. And also baby will be and also no home. Say or also baby. And she say sperm number na fertilize baby and sia. Na near Nyamia Shisha Nkosono, Esi, na a breaky, na a bar, baby and also will be and also shared it, and also break it down. It builds up, it breaks down, and it's also trying to behave just as is in the uterus. And see, unfortunately, yes, a honor or the point of nature. Unfortunately, those places now a wono, any a quite be naturally, a was all mofa. So then it's like a cycle. It breaks it down, now build it. So it means that those tissues are just accumulating inside. And unfortunately, you know, a builder, now as a body no behune say ebia a crow, then it will heal it, then it will form a scar, then it will break down. It's a month, every month there, and nobody know, and also yebi. So say at here, until all by your menses no, and also air prepare no home. One all your menses now, and also I break it down, but it doesn't have an exit. Until as I be go on now a healing now. So it's a monthly cycle that you go through. Then unfortunately it forms scars. And see, baby I made the chair mono. This is Oba or no wenya endometriosis. And to see a good difference, no. Also, I feel who say I said, "Baby red, be our ovaries no ho, bread be our uterus no, eso and kete. So those are the endometriosis. And see every month be and also yeah, and also yeah, and also yeah. So that is what we call endometriosis. So in English, they will tell you that It is the presence of tissue similar to the endometrial tissue, which grows outside of the uterus. It responds to the hormones in a cyclical manner. And so, as it goes through that monthly cycle, they do form scar tissues, then it forms adhesions. The adhesion as a band, bisano. Na asoso internal organs, na are sticking together. Inti ebi oha, obi ya ne mensisa, ne ya ne ya, ontimi nyeshe. So that is how come I knew something was wrong with me. I think I started having my menses in 1999, somewhere when I was in JHS 2. It was without any pain. Then, me drew university, no. First year, every month they are menstruating. Then suddenly I realized that there is a change. After they menstruate here, it's very painful. And I'm starting monitor. Me was I say this month, say pain no year 2 next month, me menstruate here, pain no year bear 4. So it was increasing. Then later, me who say me menstruate here, mean to me, free me has say me ja, me abdomen, me ja, me chi. Mean to me, for 3 days I would be in bed. The only thing I can do is to take some water and just some fluids. But for some reason, I felt, I'll be fine. Once I make a child, say, may start, me can say, sometimes, my no say, and for some reason, so I felt a bit paranoid. Say me no medro, inti me no medro. Me say me no medra ebeka ho. Me no parasa inti me no. So I will manage the pain. It was so bad. Eboa eba, menya constipation. Even to go use the toilet, it's a headache. It's painful. Eboa ojonsa, yeah, that is when you are menstruating. Then also diarrhea. So it presents in so many forms. But then I told myself, me will university, I'll be fine. And me team cry say, me doctor. And I said, me cancer doctor because I didn't do it. Okay. So I really. World Health Organization, any other researchers, who say ye ema 10 esiwa emu baako ana mienu die omo wo saa yare ni bi. And eba time your reproductive years from your starting menstruate you become reproductive obema no da obetimi anyem. So we term that as your reproductive age. Until you menstruate even from 10 years all the way to 50 years, what does you menstruate here? You are in your reproductive age. Until that age bracket, no, you're very susceptible to SARA. And it's a chronic disease which is associated with mild to severe pain. Obeoha obenya, but onya pain bia banewo. Obo answa onya pain. So unfortunately for me, I was in so much pain. But once I say, I started my menses 1999. Now I pain. But it started when I was in the university. I call university 2005. So for 6 years, I was menstruating without any pain. Then suddenly the menses changed. It can be say obi oha or best starting the menstruation onya pain bia, but obi also starting the menstruation na pain wo. I'm not saying say o start o menses na onya pain it means say when you endo, but o share now monitor now say pain no the way I see you no on tia say entiasia papa bi enima, I would advise that you seek medical attention. And then unfortunately, time obehu or mutimide ma will correct diagnosis. Doctors know ebetimi ehu say when ya endo no. Sometimes it takes 8 to 10 or even 12 years. Into oboha obenya pain no obeko hospital ombeye nhwehwemu, but still even some of the best doctors crano, they are not able to tell say endo. They will just give you some pain medication. And once I make a say rust, a far metal in kakran. Enti, maybe I say bia, me started my menses, no, probably it was there or it wasn't, I don't know. But me find say it started even when the pain started in 2005. Yeah, me call hospital in 2012. No, the amount me call hospital was because na ma worry and I made peba, and I said na ma worry. Then I started seeing some signs in my body, and then I'm like, let me go and seek medical attention because this is not normal. That was when I got to know. So from 2005 to 2012, that's 7 years. Until near pesa year body nimbiano aye. Until I say, and crana wahana starting moments no. When you find out, say, moments no, the pain, and yet a bit abnormal, try to seek medical attention. And on my shishaman who say, yare no, there were 4 stages. So, stage 1, a minimal, a boha, ube, endorse and spread it, bebre. Then stage 2, mild. Then stage 3 is moderate. Stage 4, severe. Just say no. Afifa. Organs now spread or baby bebre. And see, this is a typical picture of obi nawudiemu awenya endometriosis. Se mubehu sam ohe picture na what yes. No, those as a strings bino, those are the adhesions. And those tissues are not supposed to be there. Those are the endometriosis tissues that are there. And over the years, no, are forming adhesions. Now the way and it makes getting pregnant sometimes very difficult. It gives you a lot of pain and all those things. So this is a typical view of how somebody who has endometriosis, how the reproductive system looks like. Enti ehe fa wo body nim ena sa tissues way etimi e deposited. And because the lining is inside your womb, no, the common areas are obehu say sa tissues ni bi wo ho no eye o fallopian tube. Sa tube ye na Akosua ne befem e de abeto oyem. Then there are some ligaments around the uterus. You have the lining of the pelvic cavity or abdomen no lining no. Ehonso ebitimi ekohonom. Wo ovaries. Ehonso ebitimi ekoho. And outside the sa wa wodie no hono so no ebitimi ekoho. And other areas yedunso twa no bladder no ebitimi koho. Ebu oha ni intestines ebitimi koho. Ebu oha o vagina no so ebitimi koho. Ebu a baby a o rectum. Intina ebu oha constipation. Onya the menses then the person will experience some difficulties and then some pain. And then they've also done some research to know say there are some rare areas and can we expect to say bekoho. The tissues in their arms and legs. So you can see how this disease can actually take control of your entire system. When I started doing the advocacy, to create the awareness, I had somebody reaching out to me and not say nefruma. Or it's me and no court check here and no muhu say endometriosis. Say or that fana sia na bibi ya no. And at that time, the guy that the boyfriend, and so you'll be or that fantasy. So you can see some of the challenges that it will bring to your home. One better or better fantasy because was or ya or no through my home. Senkama warrior, ukunuso pesa or that fantasy. And it's only a day any day. Ebinum so or more kidney no, etimiko, ne liver, ne lungs, ebo brain, etimiko, ebo ne finger. Saya reno etimi ekohono. Enti eye bibia e wo say ye ma ye nikuhu. Na say uhu signs and symptoms na what to make alcohol hospital. No akwa the ama doctors ayen hwehwe mama. Na the man ye den ma doctors so mo betimi aboa I had to say cancer or munim the cancer ebano sana yarewe insutie. They don't know what is causing it. But more some few theories be say oh ebia enuntina emano eba. And some of it near almost ebia the endometrial tissues are carried into your all those locations na makano to ebia mojano and edekoho. That is one of the theory that is being propagated. Another one is ebio oba koye surgery, then those tissues are deposited. And then ebia na o mami anase onana anase unye bi wobi enema unsu nyaye. But for me, in my case, me mami nibi, me nana nibi, me auntie nibi, mabusu emobi anibio. Extended family will be any to me a test case. Me a test case. And say be a nyankopon or said that through your pain you can also be able to help others. Yeah, you need nyankopon ba ye bibisano. E bin so how must say, oh yeah, o menses na. Some instead of it coming down, some travels back into your fallopian tubes. And then it goes to deposit those. And almost there is no because of that, they are not able to find a definitive cause and then be able to find solutions to the problem. And that is what makes the disease quite a painful one. Unim niya na yema onhuedra. Senka enhadwe. But where the doctors no munim adukro krentia sa de ne wo ho. Inti ebede no mahu no manya the right treatment and accept prevention amano. And so some of the common symptoms no enamakano. Most of the time it is pain, or most of the time it gets to when people want to have kids, they are not able to do it. They go to the hospital, do lots of tests, and then they realize that oh, endometriosis in tina, Emma. But some people are able to have kids all right, some others to no. And another symptom when you have painful menstrual cramps. And then sometimes when you have pain during sex or even after sex. I experienced that. And it created a whole lot of challenges for me and my husband because ukuna waro opese one will have sex. It's painful. It's very painful. But obey day, no one can say so. No, but you know that you are not really happy and you would have to deal with the aftermath. So that tells you, say, if you are confronted with such a disease, your whole life is like that. And then other possible symptoms, obi pese ojan na or junsa, there is pain, especially when you are menstruating. And then some people do have excessive bleeding during their menses. Oshana abnormal, I would advise that you seek for medical help. And sometimes too, when people are having their menses, it is associated with diarrhea or sometimes constipation. I used to experience that as well. And then, oh, wow, to me who said, what bread? And when I realized that things about me was not normal was, before I have my menses, like 3 days to having my menses, I am in so much pain. During the menses, for the first 3 days, so much pain. Then sometimes, while your menses never cry, some you would still experience some kind of pain. Until you be a unya sadena, I would advise that you do seek for medical help. And sometimes to obey her, the menses no, it's heavy, very heavy, or irregular, and obey the next month onya basa basa sa. So when you see some of these things, you experience them, I would advise you seek help. And then it impacts us in so many ways. Yeah, memu has say, and I be before the I wore a World Cup. I wore a dear, ain't it's sad. I remember somebody approached me. Obi catcher me say, "Oh, Matisa wawari, me de mi hu yo, se uniba." Those are some of the things. Obao, me ma me adamfo, shia me no say ako Matisa wawari, me de mi hu ye, all because Yatisa wawari 1 year, 2 years, you are not flaunting any baby bumper or background or anything, no. Yes, say we don't see say wawari. Then Bema bin so aba. Ade Bema no ntimi nya na. Ontimi nya ka che me na me mame. See, let's be kind. No, to be very honest, people are dealing with so many things. So I would appreciate it if we are kind with our words. Mamo mayem bisa aware for dabena obewo na wawo banechi na wonwo foforo wawo na dabena obewo unim ne omonamu. What if say in the personal decision say o person o ba kope? How does that, sorry to say, how does that concern you, or how does that put money in your pocket? And you say because owo a obekwa akoboano obekwa akohwe no 1 2 bi no obi eyinani. So let's be kind. Let's be very, very, very kind to people. And it also affected the quality of your life, because to say obi anami wo university for 3 days, lectures Akosua untimi nko because you are in so much pain. Some people, they can't go to work. So it affects your work life, it affects your school life. Some people do get depressed. Some people shy away from sex, because for her to go through that kind of pain, and she wouldn't even want to involve herself in any intercourse. And aside all this, it costs a lot to treat this medical condition. I remember I did my first surgery in Komfuanoche, and that one, I was working with Bui at that time, and I was on insurance, so the job took care of all the medical conditions. It was more than 3,000 Ghana cedis that time, 2012. So you can imagine somebody who doesn't have money have to go and do surgery because of this condition, and the person has to cough up probably between 3,000 to 5,000, 7,000 just for this one. You can see the kind of economic burden that it will put on you. And some research that they've done says that in Europe, the annual cost of treating endometriosis ranges between 0.8 billion to 12.5 billion every year to treat that condition. In the US, it's around 78 to 119 billion. So it tells you the kind of burden that and strain that it is putting on the individual and then the government or the country as a whole. And then They also lose time at work. If I'm to calculate the lost hours that, because of this condition, I wasn't able to go to school or even go to work, or even people go to work and because of the pain and all that they are going through, they are not even present at work. The person is going through their own, and the research shows that they are losing 6.4 hours of work a week to people who are there or physically but then because they are going through probably some fatigue, some depression, all because of endometriosis. So it wreaks havoc in your life. So just as I was saying, picture now made that a form honor. It was one of those episodes where I was in so much pain, and this is the kind of job I had to be doing because we were supervising the construction of the Bui Dam. And how many supervisors would understand? Because when your menses, you are in pain. I know sometimes. How many excuses and now the Bema every month? Oh dear, every month you better didn't cry. Oh dear, every month there are 3 days they are on bed because you are having your menses. Sometimes it doesn't make sense, but then people are going through a lot. And I remember when I did my surgery in 2012, and then I had to be going to the hospital afterwards. I was going to the hospital every single month, and I was spending not less than 1,000 cedis for the kind of medication that I had to be on, and then the consultancy charges. So I was spending not less than 1,000 cedis every month at the hospital. At a point, many nurses for me drew and say, "Hey, Waba." I mean, we will attend to you. So we virtually had to form a relationship. Because it's a minimum for like more than 2 years. From 2014 to 2016, I was working in Sunyani then. Every month, I was traveling from Sunyani to Kumasi to attend the hospital. So you can imagine the cost of fuel, the money you would have to take to the hospital to buy your medication. So I would advise that when you see any of the symptoms that we have described, seek medical attention quickly, because early diagnosis do help a lot. By the time they discovered the condition, I was in stage 4. It was a severe endometriosis, and unfortunately, it was accompanied with ascites, and I'll explain that to you later. And every doctor that I went to see always said that, no, your type of endometriosis is out of this world. Even when I traveled to Australia to study, the doctors that I went to see, 2 doctors, one of them told my primary doctor that, left to him alone, he wouldn't do any intervention on Boame because ono ebie me yam na o share senia enyeme na si aye no oni mo bia ama me ti o ka tell me doctor ne say ni oju so obetimi aye e de aboa me bia no onye dey onye. So that is how debilitating the condition is. Inti uhu ne ntema na wasa no ntem. And how would you be able to diagnose and treat endometriosis? The only way doctors can definitely say that when you're endo is they would have to do laparoscopy. When it will give them an idea that there is something wrong with you, but when if they do laparoscopy, it's a small surgical procedure that they will do. And she stress her. I just said, Emma Oda, near Chachucha or Hakakakra, near ye ovaries now, we yam one year man kakra, no more they are caught na pathologist aye bio take biopsy na pathologist akoye nhwehwemu ansana watimi aba be ka kiro say wenya endo enti it's not just yakwatwu moja yesi wenya bi debi. You would have to go through that process before they can firmly say wenya endometriosis. And for my, they didn't have to do this because when I did an ultrasound and I did a blood test, my CA125, which is a way of them knowing whether you have cancer. So if the figure is high, if your CA125 is high, then there is a possibility that you have cancer. And unfortunately for me, when they did that test, they realized that it's high. So the doctors were a bit worried. Then I had to go and do a CT scan. And you know, I was the day I had to do a CT scan, I cried. Meaning, process no sanity. Hey! Me quite no, me say. Omudin be a 1.5 liter Baltic bottle. Me no, almost a fele ba kusi homame. Me no ya, and it's so difficult. I don't know a draw chrome within, but it is difficult to take that whole thing. 1.5 liter bottle, no. Baltic bottle, me num nina wiye. And almost a year back. And no more market as here baby. Now me starting num ya. I can't cram my drew on no mobile frame. No. I threw everything out. And I broke down. Me suisa. Now me say, hey, I did the assembly. And I must say, Omunim say, Ono medrona obefe. Until no mama or two. No mama ki baby kakra. Until often near one room now, ofia. No was a small one nakaho. Said the bear, a fidiano, a bit to me, a chat or yaman. I think it goes to color your insides so that when they do the scan, all the organs can show and they can know exactly what is wrong with you. Na me ye no. They took the results to the top gynecologist in Confanoche. And the doctor said, when I was going for my results, they called me and named my husband. I said, yeah, ube uno. When doctors are going to give you a bad news, yes, and Uncle Pombo are referee. Mummy and Radias, if you saw ye, Nana Doyle or that. Because and your man, your family, or my kind of vividly, and the pain that comes with it. And yet, but Uncle Pombo are referee said the bear, oh, kind near money beer, which made the Syria come home. Na know ya. Then I was like, what is going on? And I said, oh, Ako. At that time, his uncle was also a doctor, but he passed away during the COVID. A very prominent doctor in Ghana. And also can ye guy in no my dear share them. Now me who said, asemaba. No me say Ako. Test ne nema wa ye nyina che say ovarian cancer. Na me say enti me be wu. Na say me wu aka me na say. That was in 2012. No me say it looks as if I said was stage 4 ovarian. Yeah, can stage 4 ovarian cancer only my the crow. I just say woo. Oh, I can't bear 2-3 months. You finish. And I'm saying, sir. And I'm born with him so any measurement. 3 months, 6 months. I said, Jana measurement. You don't really regret. I do any. But I was saying, yenye surgery, na yen confirm me because I look too healthy for somebody who has stage 4 ovarian cancer. I said, body no jina so the other now say, oh, cancer. And no. So I didn't have to do a laparoscopy. Laparoscopy need your omucha o ha kakra, no mucha ha kakra, no mo de efide bi ahyem na hwehwe o wawode no ho, then they will know. No my yi kakra, no makwa enti no oh enche na ho ato. But this one they had to cut right from wofuma no at the cut down. Enti it was a major surgery that I had to do. Na omo ye and na omo beka chair me say, and since then it's been one thing after the other, after the other, after the other. So many surgeries, trying to do other things so that you can have a baby. And I'm going to say, "Unya bema onte wasie na oni wo ho adaje a edin." Nti ema na ewa ha na amunya nware ye no mommo mpa ye se Nyankopon be ma mo mema omadwe nda fom omwo nyamisuro because aware no ayaware ewa emunsem no so dos And some of the treatments that you can do, it takes a whole lot to treat endometriosis. The sad thing is that it can't go away completely. So you need like a multi-modality approach. You need a whole lot of interventions. Now they are then it can minimize it a little, or if you are lucky, it will go away. Depends. And sometimes they can give you non-surgical treatment. And they can give you some oral contraceptive, some paraben, ibuprofen, to manage the pain. For me, I was given something, it's a hormonal medication that I was taking. Omode, paniano, nekasie, na ukano ma peja ubody o skin nekakra, no omode ashase, so that it will stop you from menstruating. So say, Mekacha say the tissue responds to your hormones. So if they reduce the hormones, the tissue wouldn't have anything to feed off. And also I relax kakra. So I was doing that every month. I'll do it for maybe 2-3 months. Then I'll allow myself to be off the medication. I'll menstruate. Then other things will follow. Sometimes too, they would have to do some surgical treatment. In Teboha, laparoscopy, laparotomy. Or sometimes if the condition is so worse off, they can do hysterectomy or mubeyi wawodieno efriho just to give you some sort of relief. But then now they are preaching that we should be careful of the food we eat. In the end, how healthy living be adopting. You do it. You cut out sugars and all those things that we know it's not healthy, so that you can reduce the hormones and then the insulin, and then it will regulate all that. Na amaniema ye normal ewo body mo. And you know that sometimes stress, any emotional issues, being so they or how yare na say you're stressed that it wouldn't go away. So you need to be able to minimize your stress and then your emotions so that it can also help in your treatment. But the sad thing is that they can do all these interventions and then the tissue might grow back. That's why they say it's a chronic disease. So you live with it and then you just find means of managing. So these were some of the times that I told you some few minutes ago, say I had this condition also accompanying the endo. They call it ascites. Ascites is where you have bloody fluid building up in your abdomen. And see, most of the time, it will build up, and then I would have to go to the hospital, and under the guidance of, if the pictures no ebeha obia mofancheme. So under the guidance of the ultrasound, ma anesthesia, you the hosan near the panier no erao o body no musa na koto yem na o matching fluid no said the baya metimi anya ahome kakra cause say enso fluid ne begumi yem bebre sa mintimi nidi o na ho chiro o didi keto bia na ho chiro. So they would do that just to give me some relief. And I had to do several tests for the doctors to even understand why this condition was also showing together with the endometriosis. Even when I went to Australia, they all couldn't understand why I was having ascites together with endometriosis. So that was the unfortunate thing for me. And this was one of the surgeries that I did when I was in Australia. This was in 2018. Everyone I may say, me nye advocacy BM. And Miss True say, there be Akosua, come and talk to my youth. So I have come. So this is the name of the advocacy group that I put up, Endometriosis Awareness and Research Foundation. And looking at all that I went through, I decided that I would want to create a very healthy and a fertile woman with a happy life in a world that is free of the pains and complications of endometriosis. Here, endometriosis neba, it affects everybody. It affects your family, it affects your work life, it affects every part. Obia kahubi. So we can't look on and not do anything. So me, I put myself out there and then I used to talk about it. So we used to do lots of, at that time I was in Sunyani, so we're doing lots of advocacy, talking to people about it, because it's a common thing that can just steal your very good and quality life. And I didn't want that to happen to other people. So we did lots of advocacy, and that is why I am standing here before you to talk to you about endometriosis. So I am appealing to my mothers and to my younger sisters, those who have just started having their menses and all that. If you find out that your menses is accompanied by pain, say be a worry, na you're having challenges, having babies, I would advise that seek another opinion from the doctors. No mon share, catch on me say, one mon share, say beer, no so a beer. Sometimes they can tell you, say, oh, you are normal, but then there could be other factors, because some people do not experience pain. You could be stage 1, very minimal, but you can have severe pain. Somebody could be in the stage that I was, stage 4, and not have any pain. And the only time you can see that probably will be the time that you want to give birth, and then you are having challenges. So the disease presents itself in so many ways. Somebody terms it as the master of illusion, because it can mimic so many conditions. It hides from the doctors. So you need to push. I have followed lots of advocacy groups outside Ghana. I have had lots of people reaching out to me. When I was in Ghana, from school, somebody all the way from Australia reached out, and she was like, I've been to the hospital several times. I know it is endometriosis, but the doctors don't want to attend to me. They always push me away and just give me medication. But I know that it is endometriosis. So she pushed and pushed and pushed and pushed and pushed for years before they correctly diagnosed that it is endometriosis. So please, let's do all that we can. So I will end by saying that it will be hard. We know. The road will be muddy and rough, but we will get there. So let's not lose hope. Some people are able to have kids with endometriosis. Unfortunately, others do not have it. But all in all, once we have life, we have everything. And you can always find purpose for your life. Life is not all about babies. It will be good if you have babies. You see, it's about time we normalize fertility. It will be good if you can have the baby. But if you can't have the baby, me, I can't have a baby. But I live. Miss Chumi Becca said, I live. Many Jimmy home. Like, I make myself happy. I have cried. If I tell you it got to a time that I wasn't going to church. That's how bad the condition made me feel. I was angry with God because I am the only daughter of my parents. I have 4 brothers. I'm the only girl. Yes, say, asante for obaba neye day. Yes, obaba neye oba. Oma mema ba enye oma. So my parents are hopeful that I will give birth. But with all the interventions I have done, I just say Yankupon free stroke, just a miracle. But I live. You know, we need to live. Life is not all about it. I'm very passionate about it because I have heard stuff in my ears, all because of our inability to have babies. But life is not all about babies. It is nice to have it. There are other ways of trying to get a baby. If you have to adopt, the men, I would urge you. My ex-husband told me, said, I don't know adopt Obiba. My dad was not even comfortable with the idea. I said, almost said the adoption Obiba. But you see, it's about time that we educate people for them to know that it's not just about you having the ability to naturally get pregnant and give birth, because people have challenges. And so I'll end by saying we should be kind with our women, especially the men, and then other women. Let's stop being nosy. Senyamia buanua 2, 3, 4, 5. There are there. Because you don't know. You really don't know. And nobody ever told me, say, I will get to this place. Because I started, as I told you, 1999. Not even an iota of pain. But then it changed. Things can change in your life. So I have come to appreciate the essence of life. Life is all that is important. So thank you for the opportunity to share with you, and I hope that we took something from it, and going forward, we will be kind, and we will seek medical attention as soon as possible. Thank you very much.
Akosua, thank you so much. Pacho, we will open the floor for questions.
Okay, Sister Owusu-Efaa, Nyankopɔn nhyira. Na me pese me bisa say with this, I'm not me was similar thing because me starting me menses na me hu say aba. But for some time eba na eko. Me ko hu gynecologist bebre, but it take time and almost say polycystic ovarian cyst. But looking at how you were explaining, I said it's almost like, and this laparoscopy I've done twice. It wasn't easy to work on a because with what you go through, and as you said, unknown and from with pains all the time, we go theater with a whole lot of things on theater, but we've gone through. And the parents, so they should study it because me or take quick action because if we teach man Akosua Dr. Fojo, I was very young because parents no so check mano who send menses and other things, and now I go through a lot of pain when I get my menses. Then it's DNC that I'm not pregnant because of these things. Parents no so checking now. Then people around too at times will be worrying now you should know how we talk about it because it's not easy, as she said.
Thank you very much. Akosua, I'm surprised the way she makes light of her condition. But it's any kind, I'm saying, say refrain so that sometimes we can forget some of these pain. I'll just do a little fill in. First time me coming across endometriosis, I was doing a rotation in the cardiothoracic center. There were two men. Me call na tube, and then I asked what. So not only baby or tray, it can travel all the way into the chest. The phrenic endometriosis. And then your lungs collapses. You have severe chest pain. You are rushed to the hospital. And then an X-ray is done. And then it's found out, air entered your chest and then your lungs collapsed. So you might have to have a chest tube done. And then sometimes I also ye endometriosis tissue na wall chest nina and then collapse that part of the chest. Senior bear inch me MBBM, but even with that, there was a lady I met who had about 3 of these chest surgeries, still was coming in with bleeding. And then sometimes, it's not just air, but you bleed into your chest. And then you can understand, collapse because of blood or because of air. The other place, rare, but it happens in the head. So you can have this tissue also in your head. During menstruation, people can bleed, and then they have seizures and then other things. And yes, so rare. I'm saying, 10%. You got 10%, and that means 1 out of every 10 women who are in their reproductive stage have endometriosis. May they have an example, but then that means how many women are here? It could be said no one here has it and all that. No. Prof, Pastor, which me share my slides now, then I'll just go through a few things. Okay, in terms of all kind, you can't say endometriosis, it means endometrium, I was a lining uterus, no. It be a war, baby, ancestor, a war. And see, metie ne TV show be on Gifty Auntie, and the doctor who came on the show gave a perfect example of what the endometrial lining is. So, you name pear, avocado pear. Inti offer pear na uchoma. Someone who said the uterus network, it looks actually like a uterus. Inti offer pear na uchem. now ye abano a free man. Unsayana bibi abano ewa enhono. So that is how the endometrium is. Inti sa brown na a line pen no. It's like the endometrium. Tisanete. I was saying honor just in the uterus, but in cases of endometriosis, no, they have some of these tissues elsewhere, and they are normal tissues. But in medical terms, my friend say ectopic. Ectopic, she say a need baby. I was say inti say or show some slides be and a be or baby baby. Send your kind on. Like I said, it can come to the chest, to your brain, or to the cranium. Ufuma, umbilicus, endometriosis, nina ewa honum. Enti, the normal uterus where the endometrium is supposed to be, this picture also came. Enti, essentially that. But especially for our young ones, I want to use this to show what happens to the endometrium. And so dear, but this is the endometrial lining. And only other red na yehuno. I say ebi was ebi or from no. Prof meaning say over to me I draw circle dia fa ho a. Top no a show your friend say follicles. Follicles no yeah. The fact say eggs now it develop from the ovary. Into no a show top very good. Okay. Into endometrial line and no and a what top no. And a honum and a top no a show follicles. So for the young ones or for everyone who menstruates no, it's under the direction of a number of hormones. 2 or maybe let me say 3 key hormones. One of them is produced. In fact, 3 produced in the brain. Your friend is a gonadotropin releasing hormone. No, our adrenaline no stimulates another part of adrenaline. No, also releasing 2 other hormones. And these are the key hormones that regulate everything that has to do with reproduction. Luteinizing hormone and then follicle stimulating hormone. And men it will be, but they do different things in males and females. But in the females, no, follicle stimulating hormone. I'm saying what in some cases follicles, or hormone. See, stimulating follicles, no, Emma, omu, enying follicles na eventually ebe produce or egg, no. Into a bra follicles na stimulated, na endometrium no so started stimulated. The idea is, nyanyame say osiesie endometrial lining no or ma aduane abam sene ebeya say oni be mehia na say ofa yafuna for some time answer na egg anyway na be start feeding ho no omunya nourishment from the endometrium. So that's the purpose of the endometrium no thicken up na moja bibra akom enso bibra akom sani ebeya say egg fertilized that ebetumi atom into endometrium usually na the thickness about 1 to 2 centimeters. No, a bra ube ovulate peno, the thickness can go up to about 6 millimeters or even sometimes 8 millimeters. It thickens. Say, are you disappointed, or if the egg becomes disappointed, not just a when ya sperm be a fertilizing, then you have no need for that thickness. Into blood vessels are a beshe munna no a withdraw na a start air shed off. And that is what comes out as a menstrual blood. This is the normal cycle obia or baby endometrium a go through. Into imagine say if the blood is shed off, say a BPA aba. Yes, but say a what? Say uchi. Now say it's going through this same process, and the blood is shedding off. And if an amojani beko, a bejina uchi. And you can have seizures and other things. So that is one bit. Ewo oyefuma meaning mekanya funa ya mekana yakanya yefuna. There's a difference between stomach and then the abdomen. Meka oyefuna mecha oyefuna ewo se no awode ewo hobby and suno ewo hobby o stomach ewo ho o kidneys o liver ni nyina ewo your friend say abdomen no emu. Say endometrium no ewo baby ewo say ewa uterine cavity na ubli dia beba out. But say wo oyefunu inside. So send here or try. I think this is the picture. Into way a laparoscopy and now ubiaye and the camera no extra. So I'm the last picture. No, there is a uterus. Dr. Nimadu left. Okay. But anyway, good, excellent. So there's a uterus there. And now nipa chronic bleeding and so this blood and so yeah, what we call an irritant. A good baby and say go excites your friend say inflammation. Then now I started adhesions now. Akosua Efaa once no. These adhesions no so, and then it gives this severe pain. As to what causes it, like she said, we do not know, but that is what happens. So the symptoms: pelvic pain, and this is very, very deep pelvic pain. Senior especially with sex, for those who are married. Probably something you were not experiencing before. Then all of a sudden, whenever you are having sex, and not superficial, when the man is deep, and then you are having severe pain, then you could be having endometriosis. Or sometimes pelvic pain without sex. For no pain before even menses, and then during the menses, and then some days after. Sometimes the commonest cause of this pain may be what we call when you get sexually transmitted infections. But sometimes, especially for young ones who are innocent, who haven't started meeting other men and all that, then if you are having this severe pelvic pain, you might think of something else than a secondary infection. Then the dysmenorrhea, which means painful menstruation, it might not be the only cause. Your BBF friend said primary dysmenorrhea, where there's nothing wrong with the person. And that is why endometriosis is very difficult to diagnose. To say your kind, young girl was started menstruation a year, you just be given painkillers. Unless it's persistent, and sana doctor no adrian basu say, let's do something beyond the normal dysmenorrhea. And this is very painful. I'm saying why experience it, then you can understand. Also on water, but she thinks that she's there, or she's been there before because of the pain. And me assure somebody say obi brana obunin sana ni pain, but sometimes they end up at the hospital. So that tells you that this pain is so severe and so excruciating. If a thought for Aswa, and she was right by saying that it takes 8 to 10 years, 4 years before say obia dream beba so say let's think about endometriosis. You might probably have to visit the hospital from time to time, and then someone will say, hey, let's check and see whether this person has endometriosis or not. Then self-fertility, she mentioned it. It's been realized, say, a ma omuo endometriosis, or let me put it this way first, say, a man no, it's been realized, say, 1% have infertility issues. But yefa a ma omuo endometriosis are 30 to 50% have fertility issues. So that means that once you have endometriosis, your chances of being subfertile or not being fertile, no, was sure. And she was right to say there are some people who have endometriosis who probably don't have any symptoms at all. They are fine. No symptoms, no pain, no fertility issues, no dysmenorrhea, no pelvic pain, nothing. Okay, probably time was 30 years, but she didn't know. Then she gets the pain, and it takes her additional 8 years. It was fertility that sparked this. She went to the hospital. I've not been able to conceive. So, Mamba. Then, through investigations, they realized that this was there. So, that is it. And it doesn't mean, sir, anyone who is having challenges with childbirth or endometriosis, no. But it can be a start of investigations to see why you have this. Then she mentioned painful passage of stools. We use the term dyschezia. Could also happen. As to why it happens, we do not know. But those who have endometriosis experience that. Dysuria and frequency. And I say, small time, then you'd have to go and urinate again. All the symptom way a hospital, you are likely to be told, oh, if you are when you're UTI. Okay, and make it and near my be. You get it? You be treat UTI, treat UTI. And for those of us who have the habit of shopping hospitals, you move from one hospital, the other time you feel that, oh, they didn't treat you well, you end up at another hospital. Anytime Obiabe approach you, we say something, common things are common. So that is where the person will start from. But if you overall record our facility, I mean, Obia foul fine or has last month you were here, UTI. 2 months ago you were here, UTI. 3 months ago you see there's this pattern to your conditioner. A man it's nasi. Now we decided say maybe he will take the history all over again, do an in-depth analysis of your situation. Or also not entreat the routine thing. Might want to find out why this person is presenting frequently or at this interval with some of these things, so that something can be done about it. Then she mentioned depression. And not there. She's done so well. I don't know how she does it. But that is it. Imagine every, let's say, menstruation is supposed to take about 3 to 6 days for the average woman, maybe 5 days. So imagine about 2-3 days before menstruation, you have issues, 5 days, and then maybe 2 or 3 days after. So that's about 10 days in a month. And this is going to repeat itself. It will take a stone wall not to succumb to something like this. You would definitely be depressed. And like she said, I think it's really educated me, and I have decided to be kind. And I think that all of us, as much as possible, should be kind to our fellow human beings, because you never know the battle that someone is fighting. You see, you might not mean bad. You might think that, oh, you are just, because I'm sure, say, really didn't mean bad, but to honor there, it won't sit well, because she knows the battle she's fighting, and she's been bold enough to put herself out there, said this is what she has. But not a lot of people will do that. So she's fighting with this, and then she steps out there, and then people are also saying all kinds of things. It's very difficult. So let's not be mean, and we should probably think again of what we'd want to say to another person before we let that slip out of our mouths. Diagnosis is difficult, very difficult. I think I can't overemphasize that. And you might have to visit even with a gynecologist. In fact, I am a pediatric surgeon. This is not my area. I called one of my friends, and he told me, Kwaku, Sunday way there, ansana obe diagnosed, no, the person probably 4 years. Okay, because no one would want to venture and say that this person, menstrual pain out there will feel it's normal, isn't it? It's very normal. You wouldn't venture, and laparoscopy is a bit invasive. If you are lucky, or on the ovaries, you may be lucky an ultrasound might pick it with ease. But yes, I bear back and forth. But Naomi said, when we have a problem, you have severe pain. Me massage my back for me. Massage back, it might not be so severe. Well, I do not know, but to send your car, I'm so upgrading the pain, and that was very smart. So the pain moved from 2 to 4 to 6. You realize that with every month you are having severe pain, and it's not coming down. You probably would have to start. It doesn't mean, say, immediately you go to the hospital, you'll be slapped with a diagnosis of endometriosis. No. But at least some investigations can start, and then you can get help. So she rightly said laparoscopy, some instruments into your abdomen, and then it looks around, okay, to see whether the endometrial tissues na kind say ebi ewo ho ana say ebi anywhere. Treatments, medical treatments, surgical treatments. The medical treatments can be so expensive. Panya na o kan no. Unsa meka hormone baako, gonadotropin releasing hormone. Ye oman a formulate ne analog bia etumi stop you from menstruating. And one shot is 2,500 Ghana cedis for a shot. That's Zoladex or Goserelin. That's expensive. So imagine every 3 months you have to go on this. And not the very rich. Let's look at the average person who probably earns 2,000, 3,000 a month. Okay, and having to pay this much. And this is aside other things. Okay, it's problematic. There are others. Sure, you've all heard of the combined oral contraceptives. They can be used, but side effects and all that. Then they have what they call the progestogens. They have different types. Some more my family planning, no, as I mentioned some of these things, you know, because they are the same drugs used in those places. And that is how it's medically managed. But of course, these things or these drugs have side effects. In fact, there's one drug it's like an androgen. Now, the best androgen I can use is testosterone. So androgen is the hormone that makes man a man. So when you start using those drugs, that means that you can start having features like a man, okay? Those are some of the side effects. Then there are even certain situations that you can't even use the medications at all. And of course, remember we said, fertile, papa. These same drugs are also against fertility. So the drug that is treating your symptoms, your ailments, again, is making you more infertile. So it becomes difficult. It's like a vicious cycle, and once you get yourself there, very difficult to come out. Doctors, scientists have found a way around it. They try and manage, let's reduce the dose, let's do this, let's do that, but it's difficult. And the chronicity of it makes it a bit more difficult, because once you are slapped with that diagnosis, then you are unable to get out of it. Symptoms may be managed, but it's very difficult. Then surgical. Surgical could be conservative, semi-conservative, or very radical. And she talked about it. And the radical means that uterus gone, ovaries gone. And if uterus gone, ovaries gone, what that means is that you are menopausal. So imagine you are 30-year-old and you've had to have your uterus removed, your ovaries removed. That means for the rest of your life, you have to be on medications to still be a woman or maintain your feminine features. And these are the very medications, if you listened to your breast cancer well, are the same medications that can even predispose you to breast cancer and other things. So it's a very difficult situation, and the earlier the better. You get some some help so that it might not get worse very soon. I think so. That is essentially that. And see, today is about endometriosis. Akosua, thank you again. I think you've been a wonderful presenter of your situations. I'll end here. If there are any questions, Akosua or myself would be able to deal with it. Pain associated with menses, or when you are having challenges with fertility, then probably you might have to consider it. Thank you very much.
Dr. Edase, but your question, you Honoma.
Thank you very much for the presentation. Please, I have two questions. When Doc was making his presentation, he mentioned that some of the endometrial tissues become ectopic. Have there been any research or researches in that regard as to why they become ectopic? That's the first question. And then the second is, have there been considerations for herbal treatments for endo?
So, yes, she mentioned it actually, the causes. There is something we call, but these are theories. So let me start by saying that we do not know. In medical technology, we use a term called idiopathic. And a friend coined a term out of it that we are idiots of the pathology. That we know nothing about the pathology, but there are theories. One of the theories is that there is something called retrograde menstruation. You know that when we showed the reproductive system, there is, so through your vagina there is space. And there is space also at the end of the fallopian tubes, okay? Because that is how the egg gets in there and then it gets fertilized. So there is a theory that when people menstruate, sometimes some of the blood gets back into the abdomen. So instead of coming all out, some go back. You appreciate it. And then it goes with some of the endometrial tissues and the implants. So that is one way. Another theory has suggested that it spreads through the lymphatic system, okay, or hematogenous spread. Or some people also think that there is something we call peritoneum that lines inside of the abdomen. A peritoneum can suddenly decide that I would stop being a peritoneum and become an endometrium. As to how it happens, we do not know. So that is it. Herbal consideration, yes. I am not familiar with that. Maybe she may.
Okay, so during the research, there is this doctor, Dr. Andrew Orr. He says the Royal College of Medicine, they are preaching it, that people should start with should look at it as well, the herbal medication. And I participated in this online advocacy program with another endometriosis advocacy group in the US. And a lady has actually used it. So she has also been able to formulate her own herbal medications, and together with food and diet, like if you change your diet a bit, she's been able to get her system to restore itself back to normal. So it's something that can be looked at. That's why on one of the slides, I said it is a multi-approach that you need to adopt. So there are certain foods that sometimes I eat, and then when I used to menstruate, I realized that when I take milk, sugar, leading to my menses, I experience so much pain. So you should be conscious of some of the things that you do. You can actually take time to study your body, eat some foods prior to your menses, and then observe how it behaves. And sometimes, maybe a month leading to another menses, eat a healthy diet and see how it behaves. And then you can form your own opinion about it. And then, because to be very honest, the doctors, they don't know. So you sometimes have to take things into your own hands. When you were speaking, it occurred to me that when I did the surgery the first time, my doctor recommended that medication. And then I quickly Googled and read about it. I had already ordered for it from the US. And I went to read, and it says, you start developing a heavy voice, hairs will be growing. I said, doctor, please. It's already enough to be dealing with this, but to go on and take those kind of medication, my whole effect, I can take whatever is happening to me, but I don't know. The doctor says he doesn't know how I cope. I think for some time, I've told myself that probably God prepared me for this. Me, I am this person that I make light of issues. I'm an easy-go person. I don't take so much things to heart. I make myself happy. So over the years, at first, when I stopped being angry at God, I started thanking Him that He gave me this side of me where I can easily cope. But notwithstanding, I have cried. Well, free the bottom of your stomach. Usu now awoso now akuma yoya now utiyoya mitimisu. I cry in my. I just want you to know how I have been dealing with it. It's not all smiles and all happiness and all. There are times that in my quiet space, just by myself, I have cried. I have cried. That kind of cry that usu na ohwa woso na weni nyina yoya. Uya na wa horo weni. Na wasre. Na wa hwe TV na wada. That's how I've been dealing with it. But as I said, life is very, very important. Is there any other question? Any other question? I think we can do, if there are no questions, we can close now, right? Okay.
Thank you once again, Akosua, and thank you all for your audience. We shall all take our Bibles and revisit our call to worship for our Vesper service. Psalm 125. Those who trust in the Lord are like Mount Zion, which cannot be shaken but endures forever. As the mountains surround Jerusalem, so the Lord surrounds his people, both now and forevermore. The scepter of the wicked will not remain over the land allotted to the righteous, for then the righteous might use their hands to do evil. Lord, do good to those who are good, to those who are upright in heart, but those who turn to crooked ways, the Lord will banish with the evildoers. Peace be on Israel, peace be on Sesdak. The Bible is telling us that if you trust in the Lord, you'll be like Mount Zion. And I'm sure we can all imagine how a mountain looks like. In the olden days, I learned in history that if someone wants to attack you and you live on a mountain, you have an advantage, because you could just hide there, just gather stones, and then as they climb, you just roll them down. So if the Bible is telling us that if you trust in the Lord, you are going to be like Mount Zion, which cannot be shaken but endures forever. So imagine yourself like a mountain. Anything thrown against you will not watch. Whatever problems assail you, those problems will hit, and then it will just fall off, as if nothing has happened to you. That is what God is telling us, if we trust in him, would be like. As the mountains surround Jerusalem, so the Lord surrounds his people both now and forevermore. So once you are surrounded, and you are surrounded by mountains, that means that no enemy can penetrate. And the Lord is ever present and a hedge around you. I want us to think about these words as we end the Sabbath and then go into the following week. I remember when I was a child and I get trouble, and then I walk by a tree, and then I'll look at the tree and how giant it is. And then suddenly my mind will think about God. And I say, but God created everything in the world. And look at how giant this tree is. That means that God is even bigger than this tree. That means that God is bigger than anything that we can think of. And once you put your trust in him, he has promised that you are going to be the apple of his eye. And no one can touch the apple of God's eye. So let's encourage ourselves with these words as we enter into the following week. May God bless us in Jesus' name. Amen. We'll call Elder Nkansa. Please come and pray with us. Commit the whole of today's activities into the hands of God, thanking him for how far he has brought us, the things we've heard today, and knowing the days we find ourselves in, so that we can be wise, and commit us into the hands of God for the following week. Okay.
Inyankopon e ambankese. You are come forward in your show in concron anymore. Wakwan a wode ma yen ene da bu nyina say mesomo. Ama akwanya enso ama yetumi esua ne ma bi ebebo ya pomodin ho titru efa yenua ma no ne yerenum ne maamenum. Yesrew se ensem a wode ama yen nyina ma ye ho amodin a yebetumi dia ye adwuma titru anka yesre ne se obi o ha obi ne yaka ho asemi awie nyina awo hu ne awonya yesrew brasa nipa no hye adem ma yen afa won sakano wo de oba ye bibia mu a esi yenye nti yesrew obi o ho a wo sate bia mu a yedim se wonkuto na obetumi aye yesrew ye ma yen da na wotwi mu ma yenten ka se ene wadi ahye mu na wahye ko yesrew ye firi wanim se ma obambo enkoso anya kese ewo yen so na wotwi mu ye de adwuma hodo ye de yesuku ahodo ye de nema ahodo e be nyina ahye wonsa yesese di animu kan ma yen yesre na wotwi mo be kodwa so o mokoton nema yesre ma ne yento wana wokọ adwuma mu yesre ma won favor ewo anim ne afoforo nso nya ye be ye biara na wotwi mu a e de bi mbonyam hye bebro yesre ma hu nhyira emra yen so obonsam biara abo ye ho afa ye ho adwene na wotwi mu yesre de obefa ma ye wo ya adwene mu bia e ma ne maso obambo nye kese ewo yen so ma ye ho den na wadom ma ho kwan as ye say hye mu biwa ye de aseda ene ayeye ne nkamfo ma odi na yesre pa so de se na wotwi ma ye nye nhyira nso ma afoforo se ba se na wotwi mu o ba be yi hu adi a yesre wadom nti ma ye mu biara nye firi mu to ti yen se de dawo ye ma yen onsem na me de o ma ye kra ne nipa de nyina hye se fa yen kra na kra yen so wo Yesu de mu nti amen.